Good morning, everybody. It is Bottom Line Thursday. I'm Chris Bowling. I have two guests joining me today, Mr. Chris Beyer and Mr. Brad Johnson. Welcome, everybody, to the panel.
Thank you.
We're going to talk about the major shift that we've all seen of we're seeing more physician assistants and nurse practitioners than we are physicians. It seems like we've got a big shortage, right, Brad?
Yes, and that was such a good introduction. I'm still kind of reeling from that. Wow.
Well, you set the bar.
He's learning from the best.
But it's not, well, I am kind of wearing a blue shirt. Anyhow, long story. So this is interesting. You've heard of Harvard, right? Everyone's heard of Harvard, right?
Of course.
Yeah.
I gotta quit asking these dumb questions that everyone obviously knows the answer to, but it's just who I am. Okay, so Harvard did a study. They do lots of studies, and they looked at 276 million office visits over, let's call it the past year or so. And they found that 1 in 4 is now, those visits are now led by what they're calling a non-physician, and meaning nurse practitioner, physician assistant.
Yeah.
Now I'm going to say that most folks, I've had great success when I've seen one.
Same.
Me too.
Anyhow, but I think that's a trend. And it was interesting. The study, goes to point out that in the US, we really have a shortage of healthcare providers in general, and physicians are obviously a key component of that. And so it's really a great way to augment our care system. But what do you folks feel about that? I mean, I'm totally comfortable with that. In fact, I see that growing as probably one of the fastest occupations in the healthcare fields.
I mean, I know our family's on, I think, primary care doc number 5 as a result of retirements, people moving to new providers closing, and we followed our last doctor to a new location, and it was easier to get connected with the physician's assistant, who is much younger in career and will be there for the long term, as far as we know. And I think that it's made sense for our family. I have not noticed any sort of downside in care without it being a formal doctor.
3 of our friends, Brad, their kids are all becoming PAs. And it was interesting because early in their undergrad studies, they were thinking MD, they want to become a doctor. And by the time they ran the cost analysis and just the investment of time and all of your education, these 3 young adults decided we're going to go down the PA route. I mean, number one, they kind of liked the more patient care model of a PA and a nurse practitioner than an MD. I mean, it's a lot of education. It's a lot of money. And depending on what you want to do, right? I mean, shoot, if you want to become a general practitioner, PAs can make about just as much money as them. So, when you
less schooling, less debt. Yeah. I think that, and I would think too that healthcare is paying more for that role too, because there's a shortage. You're probably seeing an inflation in that first offer, and I think it's working well. I mean, I would agree with what you're saying. I think those numbers make sense for where we are.
Yeah, I can see it just continuing to grow for sure. And along what you were saying, Bowling, about kind of the cost of medical school. I was talking to a physician specialist not too long ago, and he said he was still paying off student loans into his mid-40s.
Wow.
I can't imagine that. So this could be a way for people that have that kind of aptitude, want to help people, but really don't want to take on all that debt. Society needs them. So it was interesting to finally see that quantified. I think we all knew in our gut. In fact, I even thought 1 in 4 was maybe on the low side.
Yeah,
I agree.
Really.
Yeah. So, I think care has been good. We've had a good relationship. It's, I don't see that being to a detriment to say that it wasn't an MD that I was visiting. But yeah, it's interesting how that's progressed.
Sure is.
Yep.
I like it.
Thank you, Brad.
Thank you for sharing today, Brad. Enjoy the rest of your day.
All right. You too. See you, everybody.
See you guys.
See ya. All right. Bye-bye.